I want to do a segment kind of breaking down one of these issues that's so important, but because the day-to-day kind of political feuds don't necessarily cover this too often, it gets forgotten occasionally. Hopefully not by y'all, but we're going to make sure that we're all settled on the facts here. So the point that I'm proving, my thesis, we'll say, in this segment is the United States would benefit from and should have a universal healthcare system. And to do that, we're going to focus in specifically on a Commonwealth Fund study. They do every so often analysis of different healthcare systems across the world. And every single time they do it, very similar results come out revealing just how disgusting our system is. What I mean is we and our leaders, I should say, time and time again, allow years to pass by and us to not get the outcome and results in our healthcare system that we could get with a universal healthcare system, comparing us to other countries and not doing anything about it, when it would be not simple because the implementation of this would be rather complicated, but 100% doable and possible. We don't do it and people suffer, people die, and people are bankrupted because of it. So here's kind of a little bit of a summary from this analysis from the Commonwealth Fund. The U.S. health system trails far behind a number of other high-income countries when it comes to affordability, administration, efficiency, equity, and healthcare outcomes, according to a new Commonwealth Fund study. Using surveys and other standardized data on quality and healthcare outcomes to measure and compare patient and physician experiences across a group of 11 high-income nations, so 11 nations are being compared, the researchers ranked the United States last. Out of 11 of the wealthiest countries on the planet, the United States ranks last overall in providing equitably accessible, affordable, high quality healthcare. So now let's look at some specific kind of visuals that just show you how poorly we are performing. And the part that I want to highlight for all these I'm a fiscal conservative people. We spend more as a country on healthcare than these other countries with universal healthcare. So you as a consumer have to spend more of your hard-earned money on health insurance, and you're through that, the actual services you're getting, than individuals in other countries do with universal healthcare systems. But look at these different charts here. Comparative healthcare system performance scores. Ooh, boom, US all the way at the bottom. Healthcare spending as a percentage of GDP. What the heck? We're ranked last on all of these measures, but we spend way more than other countries compared to our GDP. Can y'all just look at this chart for a second? People say to me every day, I go around the world, I walk around the streets of America and I say, human, why don't you want universal health care? And it always starts with, how am I going to pay for it? Or, I just care too much about my hard-earned money for my job, which is, I respect that. And that's why I want to have a universal healthcare system, because we will save money as a country. You'll save money as a consumer. The only difference is your money might be going to the government, then to your healthcare services, instead of to an insurance company and then to your healthcare services. Another chart, healthcare system performance compared to spending. So compared to how much we spend, how well does our healthcare system do? Whoa. Sorry, I'm being so sassy with this. As if I haven't seen all these charts when I prepare for the show. Oh my goodness. Why is the US so far down? It's so sad. And finally here, healthcare system performance scores affordability. And again, we are so low on affordability as far as the ranking. Actually, continuing here, equity as well, all the way down there at the bottom. And we'll link this Commonwealth Fund analysis for you to look at, because there's just so much to go through. For the purposes of YouTube, I can't do it all in a way that people would find interesting, but you get the point, okay? We rank poorly on all of these different measures. When you put them together, we rank 11th, and we still pay more by a huge margin. And we accept that because gosh darn, God forbid, someone's able to have their health coverage paid for by sort of my tax dollars in theory. That's not me. Again, the only difference, what I'm offering you is cheaper health services, better coverage, better health outcomes, etc., etc. The only difference is instead of a profit-motived insurance company taking your money, then paying for your services, or you paying for them in cash, I'm going to take that, or the government's going to take that with an insurance company built by the government, like we have with Medicare, and people like Medicare, and do it that way, and we'll get all these benefits. So strange. Last thing, to compare this to a modern event that kind of where you see the stark difference. We're not going to dive into this study, but a study was done by Yale, if I'm not mistaken, yes, by Yale researchers that found more than 335,000 lives could have been saved during the pandemic if the US had a universal healthcare system. So because people aren't covered in the way that they should be, they are dying at rates way beyond what they should. It's an abomination. It is absolutely outrageous that if our leaders actually cared for us, or because they don't, we don't get this type of system. Thank you so much for watching. If you want to be a part of what makes this show possible, plus get access to the full video version of the show hours before any of the clips are uploaded to YouTube, plus get access to an extra full show every Saturday that only members can see, you can do so by going to patreon.com/Luke Beasley. That's patreon.com/Luke Beasley, and there is a link in the description.